In the past, we've spoken about eyelids and breast surgery and liposuction and plastic surgery for men. Today, we're going to talk about, this is an introduction to facial rejuvenation. We're going to give a broad overview, and then Alora is going to talk about skincare. She's our wonderful esthetician and now taking care of our front desk. And Angel will be back, and there's Raina. So, thanks very much for being here. Basically, I get asked a lot why people call it plastic surgery. Is it because you use a lot of silicone or plastic in your work? Actually, the root of plasticos, is to mold and shape and tailor. Sometimes people feel a little bit self-conscious about coming into the plastic surgeon. They say, oh, I feel like I'm vain. Actually, it's normal, natural, healthy to be concerned about your appearance. If we see someone on the street and that person is not concerned with their appearance at all, that we recognize something is a little off or a little askew. And of course, the face is a very powerful tool of communication. It's really a social tool. And when people feel self-confident and when they feel that the way they look matches the way they feel, it's a very powerful tool. And of course, second only to our voice, we communicate with our face and eyes. So this next slide here, what I call the triangle of beauty, facial rejuvenation, this is one of the most important slides I'm going to show today. People get confused, and understandably so, about should I get fillers, should I get Botox, should I have laser, should I have a facelift, should I have a neck lift, should I get cool sculpting, should I have liposuction. This slide right here is so important. There's three parts to the triangle. We need to look at all of these individually. The skin, we're concerned with the texture, fine lines, pigment changes, etc. Number two, volume. As we mature, we tend to lose fat in our face and in our hands, and we gain that fat in our trunk. It's kind of an unfunny practical joke, but it certainly happens. So keep that in mind. As we mature, we lose fat in our hands and in our face, and we gain weight in our trunk. So soft tissue transposition. When most people think about plastic surgery, that's what we're talking about. So in addition to the skin texture and volume changes, we need to look at the amount of soft tissue and where it is. Lifting, repositioning, tightening, firming, etc. Now, on top, or I should say, the foundation serves as the foundation for the triangle of beauty. Foundation, by that I mean like the craniofacial skeleton, the bones, etc. There can actually be changes with time, and some people need foundational changes. A lot of people do not, but just keep in mind, we've got the triangle of beauty on top of the craniofacial, the skeleton foundations. Now, I'm just going to go through this quickly. Alora is going to talk about skincare and how to take care of your skin. But basically, high-quality plastic surgery is concerned with anatomy, and we go layer by layer and evaluate you when we see you in consultation. This is not one of those places where you get in line and everybody gets the same procedure or everybody signs up for the same laser. Custom designed approach. The epidermis is what we see, the very top layer of the skin. Then that's on top of dermis. Then we have the subcutaneous tissue, which essentially is fat. On top of the muscle, there's fascia, and then there's lining to the bone called the periosteum. So when we talk about signs of aging, this is kind of a busy slide, but I want you to know that we need to go layer by layer and look at the skin, we look at the muscular layer, the connective tissue, etc., for a custom designed approach. Now, signs of aging. Anybody in this room can look at this young woman and then side by side with that photograph, and you could tell it's the same person, or guess it's the same person, about 40 or 50 years later after sun exposure. Exposure to sun, volume changes, it allows gravity to pull down. So, some people seem to age in a similar way if you're in the same family, but everybody ages differently, depending upon your genetics and how much sun and wind you're exposed to and your diet, etc. And so, of course, every patient deserves a custom designed approach. That's another very important slide. For example, here's this gal, and here she is about 25 years later. She has aged, and you know that, but it's been in a different way. So again, if we want to properly custom design an approach for you, we need to go layer by layer. Skin, subcutaneous tissue, the fascia, muscle, bone. So once again, keep in mind the triangle of beauty on top of the foundation. I'm going to let Alora do the bulk of the skin rejuvenation talk, but I just want to go through a few things briefly. So remember the triangle of beauty. We're going to talk a little bit about skin, and we're going to talk about volume and soft tissue transposition. Everybody in California loves the sun. However, it's not great for the skin. In fact, it can be very harmful, the UV rays. There are a few essential steps to good skin care. Number one is avoiding the sun. I'm sure Laura's going to talk about that. We need to learn how to properly cleanse our skin. Exfoliation is removing that very top layer of skin slowly. It's like skin, it's like hair and nails. It's not living. And when that keratin layer gets too thick, the skin loses some of its sheen and glow. And we want everybody to have a nice, youthful glow. Restoration. There is a layer where the new baby cells are made, and we need to churn on that factory, that germinal matrix, to make new baby cells. We need to learn how to properly moisturize our skin, and probably second only to avoiding the sun, it's avoiding smoking. This is a slide, actual skin biopsy of an area that was exposed to the sun, and after about 6 months of proper skin care, you can see much thicker layer of dermis, much more collagen, it's much more orderly, etc. Now, cosmetic skin resurfacing treatments do not remove extra skin or dramatically tighten loose skin. Now, when I show these two slides, this slide and the next slide, that the plastic surgeon cannot operate away wrinkles. We need to look at the triangle of beauty. Is it the texture of the skin you're most concerned with? Is it the soft tissue position and the amount of soft tissue? Is it volume changes? Sometimes we offer 2 out of 3, sometimes we offer only 1, sometimes we offer 3 out of 3. Custom designed approach. Now, for example, laser seems to be very popular, and it can be effective at treating the surface of the skin. However, it's heat, and it does not dramatically tighten or remove loose skin. It's heat, and certainly it can shrink tissue, but this next slide I want you to know about. Just as an analogy, everybody knows what bacon is. You take a piece of bacon out of the package from the refrigerator, and it's soft and supple, and you can almost tie a knot with it. If you expose it to heat, of course it shrinks, and we can make the skin shrink. However, that bacon, when it's heated, becomes brittle. You can break it, and what we want is supple, soft, hydrated, lush skin. And so I show this slide because when the only tool you own is a hammer, the whole world looks like a nail. And what we want to do is offer you all the tools that we have in our toolbox, all the entire armamentarium, custom designed approach. Once again, that triangle of beauty, we've got the skin, we've got volume changes, and we've got the soft tissue amount, where is it, etc. So one of the things that we like to offer is called a TCA peel. Certainly laser can be effective for some things. What I like to do before you get a TCA peel or laser is to really prime your skin up. If you equate running a marathon to having some sort of pretty dramatic skin treatment, you know, to do your best at a marathon, you've got to train and you've got to get in good condition for it. Some people actually could get out of bed and actually finish a marathon, but they might injure themselves. What we like to do is prime up the skin and get it ready for a TCA peel or laser. Again, what we're talking about is the skin. So what I like to have is when people come in for a consultation, you get a custom designed approach. We do the vector computer imager. You're going to meet my staff. You're going to sit with me and discuss your goals. I encourage people to bring in photographs from years prior because I like to see the changes in the fat compartments. I like to see the changes in the skin, etc. So here's this gal, and then she came into my office about 40 years later. So keep in mind the triangle of beauty, okay? There's the skin, there's volume changes, and there's soft tissue position and amount. So here's her follow-up photo about 8 weeks later. Okay, let me back up. So we go from there to there. Now, my wonderful staff has taught me when I'm about to show a picture from someone fresh out of the operating room, I need to warn you. So this is that same person about a week afterward. What happens with a TCA peel is not much happens for 5 or 6 days, and then for 5 or 6 days you exfoliate, and you're left with smoother, softer pink skin. You can put makeup on that, and it takes about 6 weeks for that pink to fade away. I want to show you another example. Here's a gal who needs some attention to the skin. She needs a little bit of volume, and she needs her soft tissue repositioned conservatively. Here she is about 8 days following the TCA peel, and there she is about 6 weeks later. You see she's got more of a glow, soft tissue repositioned. She's got a little volume changes, okay? So, oftentimes I'm asked about perioral rejuvenation, lipstick lines, etc. There's all kinds of things to treat that perioral lines, lipstick lines, etc. We want to look at the lines. We don't want to look at the proportion of the upper lip to the lower lip. For most Caucasians, the ratio of the upper lip to the lower lip should be about 1 to 2. For dark-skinned Hispanics or Africans, it's about 1 to 1. So everybody's different. What we're trying to do, if you look at those kind of etchings or deep perioral lines, what we're trying to do, if you can imagine a hill next to a valley, we can fill up the valley and we can bring the hill down a little bit to make things more even. That's basically our goal in a lot of these etching procedures where people come in with deeper lines around the mouth. Good skin care followed by TCA peel or scrub, sometimes dermabrasion, sometimes laser, depending on your needs. Here's a gal very concerned with what she calls lipstick lines. She told me that she even avoided the use of a straw because she was so self-conscious about it. So there she is after proper treatment. Far less etching and far fewer deep lines. Here's a gal who has...
What did she have? What type of treatment did she have?
Okay, so we went from there to there. So we put in a little fat grafting, and we did a TCA scrub.
Okay.
And here's a gal, far fewer lines, but she's still one of those treated, and there she is. Similar thing, a little bit of fat and a scrub with the TCA.
Thank you.
So, you're very welcome. So that's an introduction to skin, and Laura's going to continue our discussion. I do want to talk a little bit about Botox because it's so popular. We do a lot of this in the office. Botox is a muscle relaxant. It started out as a medical treatment for any type of muscle imbalance, like children with cross eyes or wall-eyed. It's called esotropia or exotropia, different muscle spasms. So what it does, oh, by the way, it's also good. It's also good for any muscle spasm. It's good for excess sweating and certain types of migraines. So we know that there are muscles around the eyes that when they contract, it's like an accordion. It makes the overlying skin fold. And sometimes what happens is the dermis gets thin, and if you imagine a piece of paper, when you fold the paper 100,000 times, even when you stop folding, there's going to be a little crease there. So what Botox does is make the muscle relax underneath to soften the line. And we know that there are 3 major depressors of the eyebrows, the corrugator, the procerus, and the orbicularis oculi. And there's one major elevator, that's the frontalis muscle. Just as an example, here's a gal who deals with the public, and she came in and she said her clients and her coworkers were always asking her if she's in a bad mood and was she tired. Not at all. So here she is in the office, and then we give her Botox, and here she is 2 weeks later trying to make that same expression. So it's great around the eyes for fine lines. I don't want to bore you, but similar case, this gal worked at her desk a lot and felt like she was concentrating and showing that expression, didn't want to get lots of lines and wrinkles. It comes in all sorts of varieties. So Botox can be very effective around the eyes. I'm very judicious, very conservative, very careful around the mouth and other areas, but it's very good for around the eyes. Sometimes what we do is put in a little Botox to get some improvement, and if a person wants even more improvement, then we can inject a little bit of filler or a little bit of fat to help. This is what this gal had. Now, the reason why I show this triangle, it's not the triangle of beauty, but sometimes people want Botox in the neck if they have a little bit of platysmal banding. So what do I mean by the platysmal banding? The little muscles underneath the chin at what we call the cervical mental angle, when those muscles get tight, and start to pull forward. A little bit of Botox, well actually a moderate amount of Botox can actually make those muscles relax, and that makes them longer and they can fall back. So here she is in the office, and there she is about 3 weeks later. Much less platysmal banding. So again, there's the triangle of beauty, skin texture, then there's volume, then consistent and structure. So I want to talk a little bit about volume. As you know, babies, they've just got those full cheeks that you want to go up and pinch and kiss them. But keep in mind, as we mature, we tend to lose fat cells in the face and hands and gain them in the trunk. So how do we treat that loss of volume? There are two big categories. There's fillers and there's fat. Again, anybody who lives in California loves the sun. Think of the grape compared to the raisin. Think of the plum compared to the prune. As that grape loses volume and moisture, it becomes more like a raisin. Probably the older style of facelifting, we pull the skin really tight to pull out all the wrinkles, and we cut off the extra skin and sew up really quickly. What we want to do more now, a more modern way to do facial rejuvenation, is what I call volumetric facial rejuvenation. Certainly we want to lift and firm the tissues, but we also want to fill, because as we mature, we lose fat in the hands and face, put it on the trunk. So a much more natural, a much more vibrant look is to help restore volume and not just pull on that skin of the raisin to turn it back into a grape, or pull on that skin of a prune to turn it back into a plum. Let's hydrate, do volumetric restoration. So that can be done with fillers that we get off the shelf, Juvederm and Restylane and Belotero. It seems like there's excuse me, a new one every month. It fills lines, plumps tissues, and we can do non-surgical facial sculpting. It's great for this area that I call the arc of beauty. It's great for the cheekbones. I like to augment augment the facial skeleton with that. We can do a little conservative chin advancement. We can fill in lines. But fats and fillers are two ways that we can help restore volume. And I'll talk a little bit about how we use a person's own fat instead of filler. So again, we want to think about volume. And when I talk about the cheekbones, that's great volume, of course. Regardless of your gender or your ethnicity, to have high cheekbones, you know that expression, the models have very high cheekbones. So we're okay. I hope I'm not boring anybody.
What I'm questioning
Yes.
is, how long do these fillers last?
Okay, so that's such a great question. There are many different fillers. It depends on the filler, where it's going, where we put it. For example, Voluma, that's a heavy filler that goes deep. It can last 1 or 2 years. Something that's very light, like the the old type of actual collagen, that seemed to only last for a few months. Now, this is a great question. Let me go one step forward. So that's fillers, that helps restore volume. There's another way, is the use of a person's own fat. So, as I said, you've heard before, we tend to lose fat in our face and in our hands and put the fat on in our trunk, for both men and women. When we can do conservative liposuction of the tummy or the flanks, say, and we let the fat decant or spin it down or centrifuge it, we can take that fat and re-inject it other places. Cheekbones, chin, under the nasolabial folds, even the breast, even the buttocks, etc. And I'll talk a little bit about that. So that's that's the body's natural filler, natural replacement. And roughly 67% of that transposed volume, the fat cells, will be there. It just takes root. It's like going out, Johnny Appleseed. It's like Johnny Appleseed goes out there with a whole bag of apple seeds, and some of them will take, some of them won't. So that's the way fat grafting is.
Okay.
So, for example, here's a gal who was certainly not ready for a facelift, but she wanted a little kind of pick-me-up. So we did a little volume restoration in the office and a little mini lift. So she goes from there to there. Now here's a gal, good-looking eyes, but she noticed that with time, she was losing what she felt were her high cheekbones. Right in the office, we can make people numb. It's a lunchtime treatment to augment the cheekbone and sort of bring some of that definition back. So we go from there to there. Okay?
Okay.
Now, here's a gal who came in and she felt her lower eyelids were tired looking, She's not ready for surgery. She doesn't have a lot going on. But remember how I talked about the hill and the valley? If we can fill up the valley a little bit with a filler, there'll be much smoother tissue planes, and we call that the eyelid-cheek junction. You know, some people have what we call these deep tear troughs. Eyelid-cheek junction, we want to smooth that out. So here's this gal, and here she is about 2 weeks after filler. Smooths that out. Now, as I said before, there's fillers and there's fat grafting. Fat grafting is a person's own tissue. It's living tissue. About 67% of it will take root. Otherwise, the filler comes in a syringe. It's sterile. We can make you numb and do it. Okay, so for example, here's a gal who's good looking. She has nice skin. She has a loss of volume, and she needs a little bit of soft tissue repositioning. So we go from there, and again, I want a natural look. This is the Central Coast. It's not, excuse the expression, it's not Beverly Hills or LA. People around here want a more natural look. So we go from there to there. That helps restore volume, still giving definition. We don't want to pull really hard and flatten someone's face. Here's another example of a gal. If you look at her, you can just almost picture a balloon that's full and tight, and you take a little air or water out of it, and then it lets gravity settle in and take over. So let's restore a little bit of volume. Let's firm up the tissues, take care of her skin, and we go to there. Here's a gal, similarly. She needs a little bit of volume, she needs a little tightening, conservative repositioning of the tissues. Now what I want you to do is see the difference in the way her face projects. Because in her post-op picture, which is about 6 weeks later, she almost seems like she's got more volume, and she does have more volume. She's a little wider.
Oh yeah.
You go from there to there. So I think you can see the difference in the volume, skin, and soft tissue repositioning. Another place where I think that fat grafting is great, sometimes women, some men, they come in and they have what I call submalar hollowing. Women come in and they say they think that they're they know they're losing volume. Women even say, I feel like I'm becoming a prune or a raisin. Fat grafting works great to plump up the cheekbones, so we go from there to there. So all of these patients are mine, except when I tell you this next picture, I was featured in New Beauty magazine, and the so-called liquid facelift. This is a picture out of that edition where it's nothing but fillers and Botox. So used properly and judiciously, we can get some change. So I talked about skin, and I'm going to ask Allura to talk about skin. I've talked about volume. There's fillers. There's fat. We talked a little bit about Botox. Now, what about soft tissue transposition? In general, when I look at the face, I'm like most plastic surgeons. I like it to look at it in terms of thirds. And one thing that we have here, a piece of technology which is very helpful to our patients, is called the Vectra computer analyzer. It's 6 cameras attached to a computer, and just like that, it's just having like having your photograph taken, but it's 6 cameras. It's fed into a computer, and we can sit with you and help analyze. You can point things out. We can rotate you. We can turn you upside down. And we can even do a little conservative facial sculpting. So I look at the face in terms of thirds. There's upper third, middle third, and lower third. That just happens to be my favorite sculpture. Some of you will recognize that's from Rodin. So here's a gal who is good looking, but she felt like her eyes were just tired, even though she got tons of sleep. So a little bit of elevation of the lateral brow, a little bit of conservative eyelid surgery. We don't want to give people a startled look. So we're talking now about the upper third, the eyelids and the forehead. The mid-face is, as it sounds, the cheeks and the part of the upper mouth. And then the lower third of the face are the jowls and the neck. And we can combine these procedures. Some people say they want their eyes and their neck done, or just their neck, or just the cheeks. It's custom designed approach. So here's a gal who has good skin, but she has excess upper eyelid skin. So she just wanted to show off some creases, so we go to there. Here's a gal who felt, sorry, I just need to back up. So she has good looking eyes, pretty good skin. She got a little bit of sun exposure, but she wanted to show off her creases. And so there she is. Now, very briefly, whenever I see someone who wants to talk about their eyelids, it's very important. We need to look at adjacent structures. For example, if someone comes in and they say they feel like their upper eyelids are tired, we need to look at the upper lids, but we need to look at the eyebrows because the eyebrow is the roof of the upper lid. For the lower lid, the upper cheek is the foundation of the lower lid. Now, I'm not saying that I'm always going to lift the eyebrow, I'm always going to support the cheek, but at least we have to consider the adjacent tissues. We don't look at the eyelids in isolation. For example, here's a gal who's good looking, she has big beautiful eyes, she has nice skin. She felt she was tired looking, so in addition to addressing the upper eyelid, I made a little incision up in the hair, and I lifted the lateral brow, and then lifted this, what I call the arc of beauty, this area on the side of the eyebrow and the orbit, just to pick her up, and she gets a much more vibrant, much more youthful look. So that's common for women. Now, I said that all these patients are mine. I'm going to show you a person who's well known. He's not my patient, but I'm using him as an example, just to demonstrate the difference between men and women, especially with the eyebrow. Sometimes, for men, that low horizontal brow can be a sign of strength and masculinity. So when I see men who are concerned about the upper lids and brow, I'm much more conservative than I am with women. However, sometimes men will have such redundant skin that we do need to lift their brows and take care of their upper lids, so we can go from there to there. Now here's a guy with really good looking blue eyes, but his brows are just far too low. So conservative elevation of the brows lets him show that off. Now, before I exit talking about eyelid surgery, I want you to know that sometimes eyelid surgery is covered by insurance. Insurance won't cover facelifts or liposuction or stuff like that, but eyebrows are a particular category because sometimes there's visual field obstruction. There's so much extra skin, it's called lash ptosis, that the skin of the upper eyelid is resting on the lashes. Sometimes people call this lazy eye on the left, where the position of the eyelid is so low that actually it obstructs some of the vision. And so we can actually strengthen that muscle, lift the muscle, trim it. Here's another example of a gal who has so much extra skin, it's causing visual field obstruction. Now a person like this, if she goes for her DMV exam every 5 years, they might say, you know, you have a peripheral vision blockage. So it's medically indicated. So we go from there to there, help brighten her up. Okay, so that's a little introduction to plastic surgery of the upper third of the face. Now what about the mid-face? There's a lot of considerations: volume, underlying foundation, position, and support. Some of those structures that change are predictable, but again, what I want to emphasize about the mid-face is we don't want to pull too hard, because I've been talking a lot about cheekbones, volumetric restoration, definition. We don't want to pull too hard on the mid-face. What we want to do more often is add volume, do conservative repositioning. For example, here's a gal who wanted something done right in the office. She felt that she was losing volume, and that allowed the gravity to pull down. So conservative repositioning of the tissue, and we did this right in the office, to go from there to there. Gives her a much more crisper, cleaner, repositioned, vibrant look.